Hi, everybody. This is Dr. Richard Lipscomb, and you have joined the webinar. And the title of this webinar is Products That Make Our Chronic Bridge in Class 2 Restorative Lives a Lot Easier. My name is Dr. Richard Lipscomb. I'm a general dentist. My practice is in Maryland. I'm an international speaker. I've written articles. I've been involved in a lot of groups that review different products. And right now, I'm an owner of a private practice in Maryland. And I've also done some work in community health services in community health centers. So I have a wide range of things in dentistry that I have accomplished so far. And tonight, I'm going to talk about some products, mainly Premier products. And hopefully, as I go, you'll have some helpful tips to get you through your dental journeys. Now, I'm going to go back to last week when I was doing a class 2 restoration on tooth number 14, a MO, and I was able to numb the patient up, remove all the decay, and complete my cavity prep. But as I was about to apply the sectional matrix to the tooth, my light from my loops went out. Now, this hasn't happened to me a lot, meaning that I usually don't use the direct light from my operatory chair light while I'm prepping or when I'm doing composite resins. I usually have the light from my loop and the magnification from my loops. But in this case, my light went out. And as I was using my operatory chair light, it dawned on me that this is difficult. This is hard. I can't see what I normally can see. The light isn't the way it should be. And as I added more light, I thought that I would be able to overcome this without having to either premature cure the bonding agent or premature cure the flowable or composite that I was using. It was kind of a mess, but what saved me was the magnification from the loops that I was using. And so my point is that I'm going to be talking about a lot of products today. And the one thing that kind of allows you to use these products and make your life easier and to be able to maximize the use of these products is by having loops with light and magnification. I can't tell you how important it is to wear loops. Now, I lecture in different places, and most of the time when I'm talking to an audience, I ask the question, how many of you wear loops? And usually I'd say the most is about half. And sometimes it's less than half. And I just want to, I can't stress this enough, the importance of wearing loops and having magnification with light. Now, number one, loops allow you to see things that you just can't see with direct vision. I mean, it allows you to see the decay and remove it when you're doing cavity preps. It allows you to see the undercuts that you've prepped in doing your crown and bridge work, or any voids in the core material that you've placed. Also, what loops do, they force you to work in a more upright and the correct posture that you should be working in. And over time, this also reduces the stress and strain on your eyes and back and necks. So that's why I feel that it's just so important that if you don't have loops, get a pair. Doesn't matter what kind, whatever you can afford, as long as it has magnification and light, you should be good. Now, before I get into these products, I want to make sure that I thank Premier for allowing me to talk about their products and allowing me to not only tell you how I use their products, but the impact that these products have as I practice dentistry. Now, the first topic of products that I'm going to be talking about is topical gels. Traditionally, topical gels are very messy, taste awful. Even though they come in multiple flavors, they still taste awful. And they tend to get diluted and dissolve quickly, especially when you're placing it in the lower jaw where there's a lot of saliva. And so they don't work as well in very wet environments. So typically, when I do use topical gels, as you can see in this photo to the left, I'll first dry the area with the 2x2 that I want to apply the topical to, and then apply the topical, and then cover that topical with a 2x2, and then have a patient bite down on, in this case, a disposable bite block, as you see in the picture. And what this does is it allows the topical to start numbing up the soft tissue without too much interference with the saliva, which tends to dissolve and dilutes the topical before it's wiped away and the injection is given. Now, another option, as opposed to using traditional topical, is using this product called Topical by Premier. It's a topical gel patch that is self-dissolving, but it has adhesive properties so that it sticks to the soft tissue. As it sticks, it also releases 18% benzocaine, and it can anesthetize the soft tissue for up to 20 minutes. Now, as you can see to the left, this isn't a very big piece of material. It's about half the size of this Trident gum and about half the width of this Trident gum. So it's very small. But the other good thing about this product is you're able to form it and shape it to however way you want to. And you also can pull it apart into different pieces. So instead of one big patch, you can have 2 pieces of patches or 3 pieces, right? Depending on where you're trying to give it an injection. Now, like topical, traditional topical gels that we use, this patch, once placed, starts working in about a minute. And then as it starts working, we'll leave it in place for about 2 to 3 minutes. And then depending on what I want to do in terms of an injection, I'll either wipe it off all the way and do my injection, or if there's no injection that's going to be done, and the cavity prep is going to be very shallow, not deep, or if it's a cracked tooth where I'm not doing a lot of cutting on it, I'll leave the patch in place throughout the procedure. That way I get that whole numbing effect, not just the soft tissue, but some of the tooth is being numbed by this patch. So again, depending on what I'm going to do is how I either remove the patch or leave it on either before or after an injection. Now, the biggest difference between this and traditional topicals is that this patch is a lot cleaner. It provides a more profound anesthetic to the area that you want to numb up. Also, it stays in place without dissolving because it dissolves slowly on its own. So it's not diluted by the saliva in the area that you're working in. Now, in this case, this is tooth number 6 with a temporary crown on it. This patient has come in for us to seek the permanent restoration. And I typically, even though it's a vital tooth, I typically don't give an injection for this particular procedure. But what I will do is I definitely will place some topical in and around this tooth, in and around the soft tissue to numb the patient up so that they're at least comfortable throughout this procedure. So in this case, I've used a patch and I've pulled it apart, placing one part on the buccal, as you can see, mostly at the gingival margins around this tooth. And then the other piece I've placed on the lingual aspect of that same tooth. So that I have both the buccal and lingual covered with this anesthetic patch. Once the pieces of patches are in position, I'll have the patient bite down on the bite block. And what this does is it allows the lingual portion of that patch to stay dry and dissolve slowly on its own as it anesthetizes the soft tissue on the lingual. And the same thing on the buccal. It remains slowly to dissolve as it anesthetizes that soft tissue above the tooth that we're going to be working on. Now, in some cases, if I wanted to do an injection, the placement of this patch would have been more up into the gingival area where I would do my injection, leave it there for 2 to 3 minutes, and then remove that patch because it is very adhesive and it sticks to the soft tissue. remove that patch, and then do my injection. In this case, I'm not doing an injection. I'm going to just leave it in place and let it dissolve on its own. As you can see, this tissue on the buccal area of their lip is getting numb, as well as the soft tissue around this temporary crown. And so that's how I use this patch. It's a lot better and a lot easier than using topical, because it gives you gives you a more profound anesthetic conditions than traditional topical would give you. Any questions on that? I'm going to take a pause for people who do have questions to type them in. And at the end, I'm going to go back over these questions and answer them at the end of the program. The next product is going to be burrs. Now, Premier has two types of burrs. They have a multi-use burr, which is their two-striper burr, and they also have single-use burrs called their solo burrs. I tend to use their solo burrs a lot, especially when I'm prepping multiple teeth, maybe doing a bridge, a 3-unit bridge, or maybe doing 2 or 3 individual single crowns. Also, when I'm doing cavity preps for regular composites, 2 and 3 at a time, I think I get the most out of a single-use burr when I'm using it on multiple teeth. The reasons why I like these burrs are because they come out, clean out the package, they cut quick and smooth, and allow me to be efficient as I'm prepping multiple teeth. The other good thing about these burrs is they come in a wide range of shapes and sizes. Premier does a good job in terms of fabricating a lot of burrs with all kinds of shapes and sizes that it's hard not to like these burrs because of that. Also, if you'd like to try these burrs, Premier has a website called findmyburr.com that's linked to their regular website. In this website at findmyburr.com, you can put in your existing shape number of the burrs that you're using and put it into this search block, and it will find the corresponding Premier burr that you're using. And you also have the option of selecting whether you want a multi-use two-striper burr or a solo burr. In this case, I've selected a solo burr. And then once you select solo, it gives you the corresponding Premier burrs. Not only do they give you the number of that burr, they also give you the grit, whether it's coarse, medium, or fine. Now, out of all the burrs that I use from Premier, these are the two that I use the most. This pear-shaped diamond burr and this modified cylinder burr. The pear-shaped burr, it's medium grit. It's small, but it cuts very precise. And I use it mainly to cutting off old crowns, usually in the anterior or premolar areas. And I also use it, again, for prepping just regular composites, whether it be 1, 2, or 3 composites. It's a good burr. It's nice and small. It allows me to get into the grooves when I'm prepping for a cavity prep for regular restorations or composite restorations. I don't have to make a big, giant opening when I'm using this burr. As you can see, the cutting head is very, very small, but it's very, very sharp and does a good job of cutting through old crowns and also when I use it for cavity preps. The other burr is a modified cylinder burr. And this burr I use primarily crown and bridge prepping, but also I use it for cutting off larger crowns, like in the molar area. And the thing that I like about this burr is because, one, it's parallel straight up and down. There's no taper to it. So when I'm prepping, I'm creating my own taper to my preps. But the most important thing that I like about it is the flat head of this burr. As you can see, it's a cylinder, long and straight, but at the end, it's nice and flat. And this flat area allows me to cut nice, wide, marginal floors of my prep. As you can see in this photo, this is the burr, and this is the floor of my my prep. It just allows a nice, smooth finish to my marginal floors of my preps. Also, on the corners of this burr are nice and rounded like a chamfer. So not only am I getting a nice flat surface, the floor of my margin or floor of my preps, but I'm also getting this chamfered area, which is a good transition from my axial wall to the floor of my prep. You want that in your prepping because whether you're using traditional impression material or a digital scan, the material flows a lot better when it's nice and round and smooth like this. Also, when you're scanning, the scan picks up these nice, soft, rounded angles as opposed to a sharp 90-degree angle, which most cylinder burrs have, unlike this one where it's nice and rounded. So those are the reasons why I like this burr when I'm doing my prepping. The next product is soft tissue management. Now, in these times of fast workflow, digital impressions, scanning, you have to do a good job of managing the soft tissue. It's not really an option at this point because most scanners require you to do some type of soft tissue management, whether it's going to be packing cord or using paste and caps like I'm going to be talking about. It's a must at this point. And so for Premier, their retraction paste is called Traxident, along with their retraction caps. Now, their paste comes in two delivery systems. One is this these preloaded tips. The other is this long, thin syringe. Now, the reason why I like this product, it's quicker and easier and less traumatic to the soft tissue than packing cord. Using this retraction paste with caps makes life a lot easier as far as managing the soft tissue. Also, the aluminum chloride clay-based paste that Traxident is not only retracts the soft tissue, but it also has hemostatic agents that stop the bleeding of the soft tissue around your preps. So not only are you reflecting the soft tissue, but you're stopping any kind of hemorrhaging that may take place once you've done prepping your tooth. Along with this paste are the retraction caps. In this case, these retraction caps are made out of cotton, and they're anatomically shaped so that it gives better retraction on the buccal and lingual of your preps. In this situation, we have tooth number 14, and I've applied the Retraxident around this prep. I usually place around 2 to 3 layers of that material around the preps, as you can see. Once the material is in place, I'll position a retraction cap over the prep and over the retraction paste and have the patient gently bite down. Usually have them bite down for at least 2 to 3 minutes. And as you can see, the sculpted area on these caps, again, it allows more pressure to be placed, not only on the interproximal areas where these sculpted areas are, but also buccally and lingually as you push down or as the patient bites down on these caps. After the 2 or 3 minutes, we wash off the retraction paste, the Traxident paste. Here you can see there's a little remaining. I typically would first initially wash off the prep with a water syringe, dry it a little bit, and then go back over the prep with a microbrush, wiping it to make sure either a microbrush or a small cotton pellet to make sure that I'm wiping off any extra remaining paste that are on that prep. Excuse me. Remember, especially if we're doing a digital scan, you must clean off your preps to make sure that there's nothing left behind, especially when you're using any type of retraction paste. In this case, this paste is easily washed off. And like I said, I typically follow that up with manually wiping it off with a microbrush or cotton pellet. Any questions? The next product is Premier's permanent crown and bridge cement called ZRSIM or ZRSIM. This is a self-adhesive, dual-curing universal resin cement. It can be maintained in room temperature, so it doesn't need to be refrigerated. The indications for this cement is for retentive preps. So you have a long, tall prep with parallel lines or slightly divergent, converging axial walls. And you have a restoration that fits through those preps and has some type of resistance, then this is the ideal cement for that case in terms of retention. It doesn't work very well in very short crowns or crowns that just don't have a lot of retention, but the ones with retention and have restorations that just fit on the margins very well, this is a good cement. Most times you don't have to do anything to the tooth. So there's no etching, no primer or adhesive needed. It's just that making sure that the tooth is nice and clean, making sure the inside of the restoration, in this case crown, is nice and clean. And then you can fill the crown up with the cement and cement it away. But for best results for the cement, I typically use two products. One is to clean the inside of the crown, and that product is AvaClean by Avaclar. It's a purple solution that must be shaken up, and you can do 2 or 3 drops inside a crown, use a micro brush to kind of paint the inside of that crown, and let it sit for 20 seconds. After 20 seconds, you rinse out the solution and dry. As far as the tooth is concerned, the only preparation that I do for that is once I've rinsed it off with the air water syringe, dried it, isolated, I'll use a product called Hemasil by Advantage Dental Products. Now, this product is a very thin, liquidy, clear product that you can apply onto your preps. And the properties that it has, it not only disinfects your prep, but also it also desensitizes the prep. So I will take a micro brush, a few drops of this Hemasil, paint out all around my tooth, on the axial walls, on the floor of my margins, just soaking it for about 10 seconds with this product and then air drying it off. Now, I don't want to desiccate the prep, but I just want to make sure that there's no excess of this solution on the prep. With that, cleaning the tooth and cleaning the inside of the crown, you're ready to use this ZRSIM as your permanent cement. Any questions? I'll pause for a minute, allow people to type in any questions that you may have. And then this last product, I know class 2 restorations can be a problem. As I started off this presentation, sharing with you the troubles I had when you don't have light but you have magnification with your loops. I think that a lot of times doctors get in that same situation where they don't have enough light and they can't see what they're doing, and thus trying to create a restoration that's going to be adequate for that tooth in terms of trying to complete a class 2 restoration, it's hard, it's difficult, especially when you can't see. And I usually sometimes have a hard time with loops and light. But the advantage of doing that is that I can see when there's bubbles in my flowable that I've placed in a box. I can see where there's missing areas where the composite isn't covering the box the way it should be. And as I see that, I can make corrections. Whereas when you don't have lighting, you don't have that to your disposal. And so with this system, it's called the X5 sectional matrix system by Premier. I've been using this system for about 3 or 4 years now. It's a good system. It's made up of the wedges, the matrices, the forceps that allow you to position the ring, the matrix holder, and then the main part is the ring. Now, the biggest thing about this system is that it comes with multiple rings, one size at very low cost. Most systems, you get at max 2 rings that come with it, and that's just not enough. Also, if a system has more than one size, that could kind of complicate things, and you don't know like which size to use. Do I need a dark one? Do I need a light one? And so with this system, it's one size. You don't have to worry about it. I think the smallest kit that it comes with 5 rings. And so you have a lot of rings at your disposal to use at any time, because you're bound to lose one. You're bound to just not have them available. With this system, you always have rings. Look at this system. You get over like 30 rings at very low cost. And when you have that amount of rings, you don't have to worry about not being able to perform without it. The other good thing about this system is that not only can it work with the components that come with it, but it also can work with other systems, either matrices or wedges. So that's a good thing about these rings. And then the last thing is that they work just as good as their metal counterparts. This ring is made of a hard resin. It has some give to it, but because it's a one size fits all, it's able to accommodate whether you're working in the premolar area or the molar area in doing a class 2 restoration. Now I'm going to walk us through how I use this system and troubleshoot some of the areas that come up when you're using a sectional matrix. I want to start off by saying, even though we're talking about sectional matrices, there are some times where you just can't use them when the restoration calls for a very wide and big cavity prep. There's nothing wrong with regular Toffenmayer bands and retainers and regular matrix bands and wedges. Sometimes those need to be used. But for the most part, when I'm doing any kind of straight up routine class 2 restoration, this is my go-to system that I use. As you can see to the left, cavity prep. I think this is also tooth number 14, a DO. Once I'm done with the prepping, I want to make sure that this box, at least the bottom part of this box, is as straight as possible. That gives me the best chance of placing a matrix and making sure that I have a nice sealed box at the gingival portion of the box. And as you can see, this is nice and straight. This middle picture shows the placement of the matrix in place, along with the wedge that's going through interproximally, and the ring that's not only holding the matrix in place, but also is moving the tooth or giving some movement so that once this ring and wedge is removed, you have a nice tight contact. So there is some pressure being applied by this ring to create some separation between tooth number 14 and 15. And as you can see, there's a nice, good seal at the gingival margin of this box. Once I've placed the matrix and the wedges in place, I'll go back and start treating the tooth. I'll do a selective etching around the enamel margins. Once I've washed away the etch, I'll apply my bonding agent. And what's really important is that once I apply my bonding agent, I make sure that I air dry it for 10 to 20 seconds. And then at this point, I'm using some type of instrument. As you can see to the right here, I'm using a plastic instrument, even though this is the phase where I've already applied my flowable. I also use the same instrument after I apply the bonding. And before I light cure that bonding, I'm applying some more pressure against the adjacent tooth so that I don't break the seal of that bond once it's light cured. So basically what I'm saying is the sequence of how I place the bonding and this flowable material is that once the matrix is put in place and the etch is removed, I apply the bonding. I lightly dry out the bonding for about 5 seconds. And then at this point, I'm using this instrument to create a more positive contact with the adjacent tooth. With the instrument in place, I'm going to light cure that. And what that does, it kind of stabilizes that matrix so it's not going to move up or down, and it seals off the box between the matrix and the tooth. Once I do that, I apply flowable composite and what's called framing the box. I'll place about 1 millimeter or 2 at the very gingival portion of my box, and then also bring it up to on the buccal and lingual sides of the box with the flowable resin. Once I've completed that, again, I'll take this instrument. Now at this point, I'm not putting a lot of force on it because I don't want to break that seal of the bonding agent, but I'm just going to gently kind of make sure that this matrix is against the adjacent tooth as much as possible. And then I'll light cure this. Once I light cure this, I remove the instrument. I put another layer of flowable down, light cure that. And then on top of that, I'll finish it off with regular composite. So that's the sequence of how I feel this class 2 restoration. Now, a lot of times, as you all well know, that when we're working with whether it's regular matrix bands or sectional matrix bands, it's not always easy to seal off that gingival margin of our boxes. So one of the things that you can do is use, whether it be in this case, I'm using a cotton pellet or a small piece of Teflon that can be tucked in between this area between the teeth and the ring. And so as you can see by this green circle, I have a little gapping of my matrix. And what I'll do is I'll take this cotton pellet and tuck it in between so that it has a chance to close this gap between my matrix and tooth. To the right here, you can see me using a probe to kind of tuck this down in between these 2 teeth. And as I tuck this down, it's going to push against this margin of the matrix and seal that gingival margin. Here's that cotton tucked down into place. And this is the same cotton right here. And as you can see, got a nice tight seal with the matrix and the tooth in this area. And that's what I'm trying to achieve. I typically like to use this cotton pellet because if there's any moisture in and around this area of the box, it typically can kind of absorb all that to allow the environment around this box to be nice and clean and free of saliva. Another situation that comes that can help in terms of sealing off that gingival portion of the box is utilizing the plastic wedges. Now, in this case to the left, this is how we traditionally would place the ring, with the ring tines going over the wedge so that you have the wedge coming through those tines. When you have any kind of gapping in between your matrix and the floor of your box, you can take this ring and allow the tins to kind of push that plastic wedge up against the tooth. So instead of having the wedge going through the tines, you're going to have the tines on the other side of this wedge so that it's pressing it against the tooth and thus sealing off your gingival box. So that's another way of trying to accommodate a nice tight seal at that gingival level of your box. Then at this point, I'm going back, applying my bonding, light curing, and applying my first layer of flowable composite to shore up this box area. And as I mentioned in the beginning, this is my email address. If you have any questions, even after today, you'll feel free to email me and I'll respond back. If you want a copy of this presentation, again, email me and I'll send you the whole copy of the entire presentation. I'm going to go back and look at some of these questions. Bear with me. One of the questions from the start is, how does the Premier patch compare to Orachix gel? In this situation, the Orachix gel is probably a little bit stronger than the patch. The patch is more of a topical gel, whereas the Orachix is a lot stronger because with the Orachix, you can use that in terms of scaling and root planing with periodontists or hygienists. So it's a little bit stronger. But I typically don't use my Orachix when I'm doing either crown and bridge or a regular cavity prep for a composite filling. In those cases, I would rather use the patch. Another question is the Traxident more effective than the Hemodent and Accord? So in terms of ease and situations that come up, traditionally, if I have a straightforward case, crown and bridge, prepping tooth number 30, I don't have any deep margins, the soft tissue isn't very thick and not bloody, very healthy. In those situations, I could go with the Traxident. However, when you're talking about extreme cases where the margins are deep, sub G, you have bleeding, definitely I'm gonna use another method of soft tissue management. In this case, I probably would use a cord because no matter what, cords do work in every situation. Whether you're using a 2-cord technique where you use a thin cord first and then putting a thicker cord on top of that, that typically you can typically manage most situations with the cord technique. As far as the Traxident and caps, I use that routinely. So I would say 9 times out of 10, I'm using the retraction paste and cap. And then that other 1% time, I'm probably packing cord. So but that's good. I'm still being efficient in terms of how I'm working. Another question is, looking through these questions. One of the questions is, can I repeat the steps of cleaning the tooth off? So if I go back to the Zercem or the ZRSem cement, what I do is, as far as the tooth is concerned, I make sure that I rinse and air dry it off, do regular cotton roll isolation. And if we're talking about tooth number 19, isolating on the buccal and lingual with cotton rolls. And then I'll use a product called Hemosil by Advantage Dental Products. Hemosil. And what this is a thin, clear liquid that not only desensitizes, but it disinfects the tooth. So that I use a micro brush and apply that around all parts of the tooth, axial walls, the occlusal table, the marginal floors, all around the prep. Once I've done that, I leave it on for about 20 seconds, and then I air dry it off. Not all the way off, but just air dry it so that the tooth is still moist. And then that's how I treat the tooth before I do cementation on it. Another question. Another question was how did I clean the crown? As far as the crown was concerned, in getting it prepared for cementation, whether it's a metal crown or whether it's ceramic crown, I use a product called Ivoclean by Ivoclar. And it's a purple solution. You can take 2 or 3 drops, drop it into the crown, the inside of the crown. I use a micro brush to kind of scrub around the whole inside part of the crown and let it sit for 20 seconds. Once it sits for 20 seconds, air water syringe, rinse it out, dry it completely out, and now it's ready for cementation. So that, along with treating the tooth, and then using the permanent cement, in this case, when you have good retention, the ZR-Cem is a good cement to use. Going through the questions. One of the questions are, do I treat the crown preps with Monobond after I use Ivoclean? I typically don't use the Monobond after using the Ivoclean in terms of cleaning out the inside of a crown, especially with this self-adhesive cement ZR-Cem. You don't need the Monobond. You can use it, but it's not necessary because this is a self-adhesing cement. It does a good job of adhering to not only the inside surface of the crown, but also the tooth surface itself. Whether it's more enamel or more dentin, it sticks to it. Reading the questions. One of the questions is, when you bend the wedge around the margins of the box, a class 2, do you turn the sides or place the wedge in normally? It looks sideways when you. So how I did that was, I'll place the wedge in normal and then engage one part of the ring or one side of the ring normal. And then on the other side, instead of just engaging right over it, I do turn that ring and then make sure that that wedge is long enough and just kind of place it so that the wedge is on the outside, but near the tooth, so that when I release the clamp on that ring, it pushes that wedge up against the tooth more. I'm going to go back. Okay. And so again, place the wedge as normal before I put the ring on it. And then on the side that I want this wedge to bend, on the opposite side, I'm placing the ring as normal. The wedge is going through the tines in the middle. Before I let or release this ring onto the tooth, I'm going to turn this ring this way more so it's going to land here so that this wedge can be pushed up against the tooth. So again, normal positioning for the ring and wedge on this side, but before I engage it on the other side, I'm going to start here, turning it, and then moving into this position. Again, this is tooth number 14. This is not an easy thing to do. However, when you have loops and magnification and light, it makes it a whole lot easier. It looks more difficult than it really is. Going through the questions again. The question is, if you place cotton against the gingival part of the sectional matrix, how do we keep the contact from opening? And so let me go back one more slide. Once I position this cotton to seal off this portion of the matrix to the tooth, as I did here, I'm going to go back up against this tooth and making sure to burnish and making sure that I have good contact with the adjacent tooth. So it's placing of the cotton and then going back and making sure that I burnish, not so much at the gingival portion of this box, but from the middle third up, I'm going to make sure that I have good, strong contact in that area. And the same thing when I go to bond, before I licure that bonding, I'm going to place this instrument right against that area to allow for positive contact. This cotton pellet, I'm not trying to introduce it more interproximally than it needs to be. I just need to get it right here to close this gap between the tooth and the matrix itself. Going through the questions again. The clear liquid desensitizer, that is called Hemosil by Advantage Dental Products. Hemosil. Another question. Looking through the questions. Okay, it seems about good for the questions. Again, if you have additional questions, my email, questions, or if you want a copy of the presentation, I can email that to you. Hope this was helpful and enjoy the rest of your night. Thank you.